We met originally through a mutual friend who'd been on the Masters in Education course that I run here at Imperial. And then I came over to visit you in your studio. And I remember that vividly because for me it was the first time I'd actually seen inside a tailor studio or had any insight into what was going on. And I remember you showed me the various stages and talked to me about the various stages that you go through when you're making a suit for somebody.
Yeah.
And each of the stages you described seemed to me to resonate with the things that we do in surgery.
I think initially the obvious connections were more with the sewing.
Yes.
And then through the discussion and so forth, it became apparent there were a lot more parallels in terms of the aesthetics of what I do and the aesthetics of a procedure and trying to visualise what you're doing before you start it and so on and so forth. So not just the skills that you have with your fingers, but all the skills that you need in order to do those things with your fingers.
Can we look at one or two of the techniques then that we've got in common? I mean, when people think of surgery, they think of surgeons sewing things together. I think when people think of tailors, they think of tailors sewing things together. Yeah. So sewing would be an interesting one to look at.
Yeah,
We've talked about that before. Can you just show us some of the ways you might sew something?
I'm just trying to equalise the position of the right arm.
Oh, I see. So you're using a straight needle here?
Yeah, we only use straight
needles because we pretty much almost always use curved needles. Not always, but largely.
I think that's partly because we can move things around. We don't need a curved needle.
So it's very interesting because a lot of the techniques that vascular surgeons who sew up, who operate on the blood vessel system, who are sewing arteries together and things, were very much influenced by a man called Alexis Carrel in the early part of the 20th century who learnt a lot of his techniques from Belgian lace makers.
Oh, that's interesting.
Absolutely. And so there's a sort of early transfer from the world of tailoring, or at least lace making, to some of the ways in which you get at to put in stitches at the back of a blood vessel, for instance, because obviously you have to put in stitches all the way around, otherwise it will leak.
Yeah.
Are very much like what you're showing now, where you flip things over. Yeah. You then work on the back, and then you flip them over again and work on the front.
Yeah. No, exactly.
So this to me as a surgeon, this seems quite familiar. This way of doing things. Here we are with a skin wound, and if I just show you how to put in a suture here, so you can see that unlike you with your straight needle, we use a curved needle. We don't hold it directly. And what we're trying to do is to get the right kind of tension. Yeah. Not if you put in a stitch like this and then tie it very, very tightly, like that. Yeah. You're bringing the edges together, but you're squeezing them so much that you're going to cut off the blood supply. Right. And so although it may look all right to begin with, within a few hours it'll all swell up and then it'll go horrible. And it's likely to become infected. So you're having to have an awareness of what's going to happen after you've gone, rather than just what it looks like at the end. Whereas if, of course, you put one in that's so loose that it doesn't do the job, then it might as well not be there because it's not doing anything. Yeah. And so you've got to get the balance right. Yeah. But there's also this question, isn't there, of knowing what you can do, what you can't do, what materials to use, how to use them.
You need to understand how a material is going to react. So, for example, a silk jacket is going to behave very differently from a cashmere jacket. Different cuts will work with different fabrics. The size of the sleeve will vary according to the cloth, because some cloths, when you put a sleeve into an armhole, the sleeve's a lot bigger than the armhole it goes into. And it's only through the knowledge of working with your hands, making things, with all the different interlinings and cloths that you would use, that you can make accurate decisions as a cutter.
Mm-hmm. That's very interesting, because that too resonates with surgery. If you're putting two bits of intestine together, or you're joining one artery to a different sized artery and that sort of thing, you have to make similar sorts of adjustments so that the bits fit in, and you get to know how much you can stretch things and how much you can't. This is a bit of intestine, which is rather smaller than you would find in a human. Let's say you've cut out a tumour or something in a wedge of intestine. Having cut that out, you're then left with these two edges which need to come together. And it's very important that you bring them together without putting undue tension, because if you put too much tension, then that'll cut off the blood supply and they won't heal properly.
Yeah.
And then it'll leak a day or 2 days later or something when the operation's over. And that can be a complete disaster.
Yeah.
So you have to be very much aware of how much you can pull things and how much you can't. There are very interesting parallels between, those techniques that you were using to put the sleeve in. Instead of different sorts of cloth, it's different types of tissue. And of course, this type of tissue is very different from working on an artery or liver or whatever. In the same way as I'm sure linen and fustian and whatever else it might happen to be have different characteristics.
It was one thing that I noticed that was quite different from going to university, where you're told something, you learn it, and you move on to the next thing. Whereas with learning the sewing tailoring, it's the repetition. So you learn it, you think you know it, and you don't have the faintest idea about it. And it's only by doing it, several hundred times that you start to feel it in your fingers, and then you know.
Yeah, so there's a sort of knowledge that's ingrained, but you can't put it into words.
Exactly. Your fingers have to learn it, not just your head. And it can be frustrating because you feel like you know it, but you just can't do it.
Yes.
Gradually, by redoing it and redoing it and redoing it, you begin to learn, and you begin your sensitivity to it changes.
If somebody's learning, they can practice again and again and again. You're
exactly.
not throwing it away and doing a new one each time.
No. Sometimes you have to. When people are first on their own as a tailor and they're making entire garments, sometimes you have to remake the garments because there's a flaw in the garment which you can't put right at the end. So
we can't do that with our patients.
So. A little more final.
Yeah.
Is it difficult when you're performing an operation to keep your fingers relaxed?
To begin with, yes. To begin with, you're focusing very much on learning techniques, and you're focusing on learning unfamiliar ways of moving your hands or holding instruments or whatever, and you do tend to tense. I think once that's become ingrained, once your fingers kind of start to do those things automatically, you can then relax much more.
Yeah.
And think about the whole thing as an integrated task, and instead of seeing it as a series of steps, you see it more as a whole operation.
Yeah.
You see it as taking out part of somebody's stomach, rather than as individual components. You think ahead to where it's going to be when you finished it, in a sense.
Yeah.
I think the plastic surgeons do that even more, because they're having to think beyond what they'll be doing during an operation, even beyond what that person's going to look like when all the stitches are in, or even what it's going to look like when the bandages come off 2 weeks later, but what it's going to look like in 6 months or a year when all the tissues have settled and things have changed. And so they have to have a much longer trajectory, much longer sense of time, because it's very often a relationship that goes on for a long, long time, and many plastic procedures will need several stages. And from what you were saying, the relationships you develop with your clients also go on for many years.
They do, because, for example, people's postures change and weight changes, posture changes and weight changes go together, and so you will need to revisit garments at a later point as the person's body changes. So you're trying to make the best possible garment, but with the parameters to be able to change it in the direction that you want to change it.
Right. So how long might you have a relationship with a customer or a client?
It can be any period. I mean, for example, my predecessor had customers who he started with in the 50s, and he carried on until he died in last year.
Oh, I see. So that's 50 or 60 years. That's a very long time, isn't it?
Yeah, exactly. Yes. So you can see the changes of measures that took place over different years. It's even more prevalent on the trousers, which is often the case. That the waist has changed, so there's lots of different waist measures and seat measures.
It's like the rings on a tree, isn't it?
Exactly. And on the jacket, you can see that quite clearly with where the paper's been added on and how the posture changes according with the weight. This is the construction line running across his chest. you can immediately see that he stoops in a very pronounced way. Ordinarily, the neck point on the back and the neck point on the front would be fairly close to level. Whereas here you can see that there's a considerable difference between them. This squiggle here suggests that there needs to be a lot more cloth in the back than normal. The line with the dashes through suggests that he has prominent shoulder blades in that particular point. If there was that mark but in blue, he's only got the right shoulder blade prominent. If it was the blue and the white, it means they're both prominent, but the right's more than the left.
So this is very much about personal relationship then, which is something I just simply it hadn't occurred to me until we started talking, that there was this very strong sense of needing to build up a picture of an individual with all their peculiarities and eccentricities, if there are any, in order to make something that's going to work as a suit or whatever. Because certainly from my own perspective as a clinician, as a surgeon certainly, but then more recently as a GP, an awful lot of what being a doctor involved was very much that. It was about trying to build up a sense of somebody, of different facets of their personality, of what they were, what they thought the problem was, what I thought the problem was, what were the issues really.
The first time you meet somebody, you're trying to gather a lot of information, and part of that information is added to through the fitting process. So it's not a question of deciding right at the beginning exactly how you want it to be made, but because through the process you will learn more about them, more about their life, more about how they stand, more about how they move, all of the other facets that make up how you would cut the garment for them. So you're trying to fit the character, the lifestyle, you're trying to make the body how they wished it to be, rather than necessarily how it is. So in the way that you cut it, the way that you make it, you're trying to hide some aspects that perhaps they're not comfortable with, enhance others they are comfortable with, but at the same time, because you have an objective view of them, hopefully, you do it in a way that will be that will fit into the other variables of their life.
It's very interesting because when you first started talking to me about this, it made me think of plastic surgery particularly, not in the sense of cosmetic surgery so much as reconstructions when people have had facial injuries or burns or breast operations for cancer or whatever, where you're doing something to the surface, to the external appearance of somebody that has a profound impact on how they see themselves as well as how other people see them.
This has to be longer than the cloth on the outside.
One of the things that came across to me very strongly was this very high sense of professionalism, of doing the right thing, of not cutting corners, of being a perfectionist, all those things. In surgery too, surgeons and clinicians generally have a duty to explain options, to talk about possibilities, to point out things that the patient won't have thought of because they don't know them, and a sort of strong ethical sense.
With anything that you do where the person you're doing it for has no idea really what you're doing, it's important to have that. Because it's only your self-discipline and your internal ethics which are going to determine that.
To me, this is just the beginning of what's turning out to be an absolutely fascinating way of looking at, in my case, looking at the world of surgery through the lenses of other people's expertise. Paying attention to what other people do has made me see what we do in a different way. Because I think when you're in a world, there's an awful lot that you stop seeing because you're used to it. And you no longer notice it. But to see the world of surgery, particularly from the conversations that we've had about how you see the world of surgery, as well as from my own observations of your world, has made me see not only the practices of surgery, but the teaching, the education in surgery, which is my particular area of interest, made me see that differently as well. How we can point out things, how people learn, how we work out what people need to learn and how they can do it, all that side of things. I see quite differently since we've been having these conversations.
I think with whatever work you do, it's easy to start to rely on assumptions. And in some way or other, it's important to be able to reevaluate those assumptions. I think this is quite a good way to enable one to do it, in a sense. And in the same way that within what you do, you can learn as much from people who are bad at it as who are good at it. You can learn as much about your profession by people that do something else as you can by those that actually do what you do.